And good afternoon, everyone. My name is David Brooks, and with me is Dr. Darren Carter. Welcome to the co-webinar by NYC SEM and Doctor.com for Advanced Pay-Per-Click Strategies for Doctors. So I'll let Darren introduce himself.
My name is Dr. Darren Carter. I'm the principal and founder of NYC SEM. We are a Google partner who drives revenue-generating traffic to websites and expands brand reach across the internet. Our other area of expertise is Google Analytics, so that we can measure all of the success for the campaigns that we run.
Great. And my name is David Brooks. I'm co-founder of Health Platforms, Inc., which is the operator of Doctor.com. And I have worked with Doctor.com over the years. We've managed more than 1,000 pay-per-click campaigns for doctors and utilizing a lot of the tactics and the ideas that we'll be discussing today. So without further ado, I'll pass the mic over to Dr. Carter.
So to get off on a very exciting note, I have to tell you that PPC advertising is war. And what I mean by that is that without effectively understanding your sales and marketing success metrics, you are not going to compete effectively in AdWords. And what I mean by this is if we take a look at the 4 steps that are required to get someone to visit from an ad to your website and then become a patient, you need to understand the cost and conversion rate of each of those steps. So the first is the cost per click. And that really is your agency's job to manage and keep the cost as low as possible. Certainly you may be doing this yourself, and there's lots of hints I've got coming up on how to keep that cost low. Second is your web developer's job. This is the person who creates your website or landing pages that are utilized for your pay-per-click campaigns. And your website has a big job to do. When someone shows up at their site, often it's a 98% chance that they will not become a lead. And so we're talking about small conversion rates that improvements can make a substantial difference to your overall cost per patient. The next is the actual qualification and sales close rate step, which is really your front office staff's job, those people who answer the phone. David's going to talk quite a bit about this. And finally, the lifetime patient value is really your job as a physician, because it's your job to keep the patient coming back, keep them satisfied with the care that you're providing them, hopefully keep them healthy, so that they remain a patient of yours and continue to refer patients to you. To give you an insight into lifetime value calculations, Starbucks has actually estimated that when a new customer walks into their stores for the first time, that person is worth anywhere between $12,000 to $15,000. And that calculation is why there is a Starbucks on every corner in Manhattan. And so it's a critical number. So let's look at that in a bit more detail. So we're actually going to look at the formulas that lead to your return on ad spend. And if you don't know your return on ad spend, this is going to make it almost impossible for you to compete head-to-head in AdWords, because the competitors in AdWords who are staying there and consistently spending understand what that spending's worth. So the first step is really calculating a cost per lead. Sometimes it's called a cost per acquisition, and it's simply calculated by the CPC divided by your web conversion rate. The cost per patient is your cost per lead divided by your sales close rate, and then that return on ad spend number is determined by the lifetime value of a new patient minus the cost per patient divided by the cost per patient to get a return. And so in our example here, we're using a $10 cost per click, a 5% web conversion rate, a 10% sales close rate, and a $10,000 lifetime value. When we plug in those numbers, we find that that makes a 400% return, which makes the $10 cost per click seem worth it. Of course, if it were a $20 cost per click, you get 200% return, which is actually still a pretty good number for any business. So with numbers like that, you would want to be spending in AdWords literally as much as you could. But let's take a quick look at some additional return on ad spend calculations. Now, if you incorrectly utilized a single patient visit visit, for example, to calculate your return on ad spend, you're going to end up with a negative 90% return compared to a 400% return with that lifetime value number. And then the next example, I just wanted to highlight how small improvements at each step of the sales and marketing funnel compound to give you a much higher increase than what you would expect sort of additively. So in this case, 10% improvements at each step of the sales and marketing funnel actually ends up increasing your return 60%. So now that we know we need to understand these numbers, how are we going to understand these numbers? And within AdWords, you need to track what are called conversions. And these are the goals that you want your website to achieve. And of course, in the case of your site, you're going to want leads. And the way that we measure leads on your site are usually calls, live chats, contact forms or appointment bookings, when they complete them and submit those forms, and clicks on email addresses that you may have on your site. For the most robust tracking, my agency uses Google Analytics deployed through a tag manager, which helps us actually do this sort of tracking. On the call front, I highly recommend call tracking, and my favorite platform is called CallRail. And this platform allows you to not only record calls, but also see the journey of the caller through your website prior to calling you. Plus it captures their caller information, caller ID information, and it shows you the digital channels from which they came, all the way down to the keyword level for AdWords. So you get an amazing amount of information. And being able to listen to recorded calls gives you detailed insights into how well your sales staff and front office staff is performing, especially with respect to bringing on new patients. From a live chat standpoint, I love an offering called Lead Chat. And Lead Chat is a fully staffed chat solution so that you don't actually have to have any of your staff working the chat. You provide some frequently asked questions, answers to those questions, and then the operator's goal is simply to get contact information so that you can follow up with the potential patient. And this really provides a really shocking amount of leads coming from your site, the fact that someone is there 24 hours a day to answer people's questions. Now, you want to track as many conversions on your site because that's going to help you by opening up the ability to do automated bidding within the Google AdWords platform. So other conversions you may consider are things like downloads, video views, or social shares, and these are often referred to as micro conversions. And Google also just debuted a feature for AdWords users within analytics, something called SMART goals. And these goals just require you to turn on a switch within analytics, and Google's going to look at the engagement of people within your website and determine whether or not they seem interested. And so it's at least a set of goals that you can use to optimize your AdWords by bidding more for those people who are like people who seem interested on your site. That all-important web conversion rate is going to be that leads number divided by the unique visitors on your site. Okay, so now that we're tracking conversions, we've understanding our web conversion rate, our cost per click. Now let's talk about how we can reduce the cost of AdWords. And there's really just a couple ways to do that. The first is to reduce spending on bad searches. And that has a lot to do with your campaign configuration, as well as utilizing the search query analysis to help you configure your ad groups and add negative keywords. And then to improve keyword quality scores, which actually will reduce your cost per click in comparison to your competition. We're going to see how writing tight ad groups, doing good copywriting, and aligning your website content with your ads can make improvements. So let's start with campaign configuration. When you create a new campaign, only ever utilize the search network. This presentation doesn't cover display or banner advertising or programmatic advertising at all, and you certainly may have a separate budget to do that sort of outreach. This one is specifically talking about search network. And what Google defaults to when you create a new campaign is something called search and display select. This makes it almost impossible to understand the performance of the campaign because you're getting both search and display traffic in the same campaign. So always select search network only. And then always select enable all features, because that enables several important switches that make it easy to improve your performance. And then I always remove Google search partners to start. I have never in my experience seen search partners perform better than Google search, and I've often seen it perform worse. And so once you've improved the performance of your search network campaign and you're happy with it, then I would suggest turning on Google search partners. Next, geo-targeting can save you tons of money. What I recommend for especially a local practice is to simply use the zip codes in your patient database. You may have some zip codes in mind that you want to reach out to. Certainly you can add those in, but I would utilize just the zips for your existing patient database only, with the caveat if you are a state or nationally scoped sort of referral center or well-known institution, you may not want to limit yourself so much. Then, very importantly, because you've enabled all features, as I just described above, you're going to want to choose in my targeted location only, and not choose the option that includes searching for location. And the reason is Google layers in a geographic search in which it uses city names, state names, and zip codes to trigger ads in those locations. And so if you're searching for a particular city that's nearby you, it may actually trigger ads in states that has the name of that city as well. So to even go farther and improve your geo-targeting, you should exclude all other states. Again, with the caveat that if you have a national or state scope, you wouldn't necessarily want to do that. But exclude all other states is going to make it much less likely that you're going to get traffic from other states from searchers who have no intent in going to your practice. From a bid strategy standpoint, I highly recommend considering top-of-page bidding and using the accelerated budgeting process. What this will do is get conversion data into your account as quickly as possible, so that you can turn on automated bidding features like enhanced CPC or cost per acquisition. Now let's talk about mobile campaign configuration. In 2016, mobile traffic exceeded desktop traffic in internet searches. And so it is absolutely essential that you have a good mobile experience for your website for you to advertise to mobile visitors. If you don't have a good mobile experience, I highly recommend not advertising to mobile visitors. It's simply going to cost you money because so many people are expecting a good mobile experience now. They'll just leave if your site is hard to navigate on a phone. And so in that case, I'd recommend a negative 100% bid adjustment for mobile devices. What you could do instead is something called a call-only campaign, which I recommend you schedule only for your office hours. And this will show an ad that contains a call-only button to mobile users. So clicking your ad is actually going to call your practice rather than take them to your website. And realize that if you are running that campaign against a mobile campaign, you are sort of bidding against yourself. And you may want to compare one versus the other with respect to the leads that it generates. And then finally, within campaign configuration are the all-important ad extensions. Google's very keen on these because they know that they increase the click-through rates on ads quite a bit. And to the right here, you can see three types: a call extension, a location extension, and a site link extension. The call extension can use a Google tracking number if you aren't using some other call tracking solution like CallRail, so that you can track calls that are coming from the ad itself. And Google even has the ability to track calls from your website by inserting dynamic numbers now. The only information you get from Google is the duration of the call and the area code of the caller. So it's not nearly the information you'd get from a full tracking solution. The location requires that you verify your Google My Business listing, which David's going to talk about. And then the site links are supposed to be useful links that are related to the search that the person has done. So in this case, when someone's searching just this broad decap insurance, there's several options of types of insurance that they may be able to go to directly, rather than having to get to the site and then find what they're looking for. Callouts are really important. These are what I like to say are just your points of difference. What makes you stand out from the competition is what you can put in these callouts. They're just small phrases that you can add that are separated by small dots that is appended to your ad. And then structured snippets, I've seen insurance coverages utilized there, services catalogs for physicians. And the more extensions you can add, the better. And David's actually going to talk about a new product that can put reviews into your AdWords ads, which is incredibly important. But Google will auto-optimize which extensions go with your ad based on search signals, location signals, all these things. And so the more you can have there, the more likely you're going to get increased click-through rates from your extensions. All right, so now let's move on to keyword selection to understand what makes a good keyword. First off, specificity is always better than something that's broad. And so if you have any services that are unique to your practice, like you do medical exams for pilots or something like that, these are really important services that you want to be looking at. Certainly the insurances you take, plus usually your specialty, so Aetna cardiologist or United Health gastroenterologist is probably how 80% of people search to find a physician in their network. So those are absolutely critical. Don't leave out your physician names, and usually append the MD or the DR to the front of the search, because this is a perfect chance for you to take control over all the different networks that are out there listing your physicians. Here's a place where you can put your physician at the top of the page and direct them to an about page on your website. Your brands of technology, procedures that are unique to your practice, all of these things are incredibly important, especially for savvy searchers who get to know a lot about the types of treatments that they require. So the more specific you can be with medical terms is actually great, because you're going to attract a group of searchers who are knowledgeable about what you're doing. And then finally, if you can, take a very sort of a combination content marketing and pay-per-click marketing approach by writing excellent pages that answer questions that your patients have. These can include things about recovery, medical side effects, drug side effects. Costs are an enormous part of the searches that people are doing. The technologies that are new and exciting on that you're providing, certainly side effects are really important. So answering these questions and advertising based on those keywords really starts a relationship with that potential patient, giving them information that they're looking for right now. And these keywords actually tend to be a lot cheaper than these broader categories like Aetna cardiologist. From a match type standpoint, I always stick with phrase match to start, because click-through rate is an important part of the quality score. You want as good a click-through rate as possible out of the gate for a keyword. And phrase, because it has meaning built into it, is the best place to start. You can expand to modified broad, which means putting plus signs in front of the keywords, after you've gotten some good performance from the phrase match. But try to use at least 3 terms when you are doing modified broad searches. And to find those terms, you can look into the search query reports, both to find extra modified broad terms, but then also to find exact matches that are consistently converting, because those may be keywords that you want to add to your account as well. Okay, so I just brought up the search query report. This is the report that shows you what actually people searched that triggered your ads. And sometimes it's not a great match with what you're attempting to do. Why you would want your ad to show. And so consistently reviewing your search query reports can let you do two things: find ways to structure your new ad groups or existing ad groups, as well as find negative keywords. And so consistently adding those negative keywords over time really helps the performance of your account and reduces wasted spend. Right out of the gate, though, negative keywords that you want to consider and put into your account are your competition. And a lot of people think they want to advertise their competition's name. But the reality is that when people are searching the competition, they know they want the competition. And so if you put your ad up there at a very expensive cost per click, they'll click it thinking it's your competitor, and they'll leave your site right away. You're not going to change anyone's mind once they're searching a brand. Certainly you want to exclude the insurances you don't take, procedures you don't do, health systems you don't belong to. All of these are critical to exclude your advertising from. And I highly recommend creating a campaign negative keyword shared library. And then you can link all these keywords to all of your campaigns. This makes it easy to improve the performance of a new campaign out of the gate without a lot of work. And then finally, there is something called structural negative keywords that really help you refine your messaging. The challenge with AdWords is that keywords can occur in any combination, and you may have keywords that compete with other keywords in your account because there's overlap in the searches that occur. And so if you've sort of structured your account in a very fine-grained way, you may need to put negative keywords into ad groups or campaigns to prevent them from triggering. And a perfect example there is if you have a single keyword ad group, you're going to want to exclude that keyword from your other ad groups and campaigns so that you're never bidding against yourself and that you have very good control over which ads show when people are searching for that single keyword. And you may ask, what is a single keyword ad group? We'll talk about that now. So improving keyword quality score means addressing the three parts of keyword quality, and that's click-through rate, the match of the keyword to the ad, and then essentially the match of the ad to the landing page. And so one way to do that is to create something called lean ad groups. And this means you're going to include usually no more than 5 to 10 tightly themed keywords in an ad group. This allows the best message match to that set of keywords as possible. So you can write very compelling ads for those keywords. Remember, the only thing, all of this talking about all of this, the metrics and all of the bids and all of the structure, the only thing your potential patients see are your ads. And so in the end, the ads are really the most important thing in all of this. And the goal is to align them as closely as possible and essentially try to mind read the person who's doing the search. One way that you have a lot of control over that are these single keyword ad groups. So once you've had keywords running in your account for 2 to 3 months, you'll start to see which ones are getting a lot of impressions and certainly which ones are getting most conversions. And you may consider pulling out a keyword and just running an ad group solely dedicated to it so that you can try different messaging to keep improving that success. And then finally, when you do make these lean ad groups, you have the option to write ad group specific ad extensions. And these are just really important to make your messaging even more compelling. And so don't forget that you can usually create a specific extension at the ad group level. Now, from a copywriting standpoint, you really want to write ads that specifically address and include the keyword that you're working on. Google looks at that closely. But in general, though, an ad should simply have two things. That's emotion and clear call to action. And so a couple examples I wrote here are explore how our award-winning docs improve our patients' lives and learn how our specialists keep you healthy with the latest tech. So here you're giving them something to do, either explore or learn, and you're capitalizing on words like improving, healthy, technology, award-winning. These are things that will pique people's interests. Probably the best suggestion I have for copywriting is simply to search the keywords that you're looking at in AdWords and look at what your competitors are writing. and then write ads that look a lot different from your competitors. You really want to stand out on that page of small text ads, and finding, just making that comparison can really give you the leg up. You may want to consider dynamic keyword insertion or business data rules. These are ways to actually inject content into ads based on the search themselves. DKI is putting the keyword itself into the ad, but the major caveat here is that you don't want the ad to sound silly or grammatically incorrect. So again, you just need to be careful in utilizing this and think about how every keyword will read when inserted into the ad. And then finally, on copywriting, never forget promotions. It's one of the most important things people are looking for on the internet. And if you have them or have thought about doing them, it's a very hand-in-glove situation. Then finally, for the landing page content, this is just a matter of aligning the content of the ads with the landing page content. And specifically, you want to think about the important HTML tags, like the title of the page and any H1 headers on the page. That makes a big difference for the quality score. If you have, keywords that are performing exceptionally well, you've pulled them out into an ad group, you've created ad group specific extensions, you may consider writing specific landing pages just for those keywords to, keep improving that performance. And a lot of times, landing pages are written to go with paid campaigns because it's just so important to continue the conversation. I often think of the ads as really just the headline, and the landing page is the ad itself, where you're going to make a compelling argument to have the patient contact you so that you can explore whether or not they would be a patient. And then finally, from an optimization standpoint, a lot of that is really around going right back to the beginning and thinking about those success metrics from the beginning, and developing strategies that make it easy for you to manage the account. And one of those most important ones is considering the automated bidding once you have enough conversions. And so an enhanced CPC can be used once you've got 30 conversions in a month. And what Google will do is bid up to, I think it's 130%, something like that, above or below for a particular, of your bid for a particular searcher based on the likelihood that that person might convert. Plus there are cost per acquisition. Target cost per acquisition is probably the most important one once you understand your cost per lead, that the cost per acquisition is matching your modeled cost per lead. If you don't have enough conversions to enable this sort of automated bidding, then you may want to just consider bidding to position 4. There are now 4 ads at the top of Google search. This changed a couple months ago. And I like that position because a lot of times people who don't like the ads skip right to the organic search results, and your ad in position 4 is likely going to be the one that they glance at, if anything. And so it can be a good ad position to actually get good conversion rates. Your clicks are going to be lower than the first 3 positions though. You're going to want to retire keywords that surpass your desired cost per lead. And the challenge here is you don't want to throw the baby out with the bathwater. If you are running the keywords, you really want to optimize for several months before you start to look at the cost per lead, because there are going to be negative keywords that you've added in that prevent wasted ad spend. There's going to be a potentially reorganization of your account that starts to improve your cost per click, or sorry, your cost per lead. And so a lot of times I wait. You can either sort of wait 3 to 5 months to then start measuring the cost per lead that the keywords are generating, or simply just consider tossing those keywords once they hit like 2 times cost per lead, where you know that this is a losing game unless you're absolutely certain that this keyword makes tons of sense for your practice. And then a final suggestion is to really look at your cost per lead at the ad group level as well. If you start to build out these lean ad groups, then you can really not have to pay attention to the individual ad keywords within the ad group and turn off the ad groups at the ad group level, rather than worrying too much about the individual keywords within it. And so those are my suggestions today, and I'm going to turn this over now to David.
Great. Thank you very much, Darren. That was extremely informative, and I hate admitting that because a lot of times clients look to me to be the expert. So I learned several things today, and I really thank you for that information. Okay, so now that we've covered the essentials of advanced pay-per-click from a point of view of advertising your campaign, let's consider what happens afterwards, and something that we'll call post-click conversion. Simply because you've optimized your ad campaign doesn't mean you've optimized your marketing campaign. Here's one sobering statistic. 70% of phone calls generated by paid advertising for the purpose of new business leads, or something that's called lead gen, 70% of those phone calls go unanswered. Either it goes to voicemail, or the caller simply just gives up and hangs up. So the bottom line is, you can benefit by hiring Darren to perfect your AdWords campaign, but you really still need to optimize the human factors that will make and break the success of your entire ad spend. So let's go over 4 essential performance boosters that we think will be something that's really important for you to consider as you think about the holistic ad program. And the first is that a poorly trained or poorly motivated staff is your worst enemy. It's really essential that the people who are answering the phone are skilled, sales-trained people who have great phone manners and who really understand how to get the person to come in and show up for the appointment. So invest in sales training, ideally based on your own values and your own personal success, or if you don't have very strong opinions about that, we'd recommend hiring some third-party practice consultants to come in and coach the people answering the phones. Give incentives and goals and quotas for appointments booked and kept, and measure and reward those things that the staff can control. A lot of times, if a caller's coming in and doing a little bit of price shopping, there are ways that you can, with clever messaging, you can counteract that behavior and get people to show up and get them to stop just asking about prices. But it's not necessarily a bad lead, it's just human behavior. So understanding psychology of the caller and especially web-based leads is very, very important. And then finally, we strongly, like Darren, we strongly recommend using some sort of HIPAA-compliant call recording solution and using that playback for like a lessons learned coaching session. It's very important not to use it as a cudgel and not to reprimand people, but to really use it as a coachable moment, a teachable moment, and get people to get more refined and better, especially looking at ones that got away. If it sounded promising, but for whatever reason, you couldn't book the appointment, using a weekly kind of staff coaching session to understand why and what could have been done better. The objective here is to refine all elements of the human factors and get people to actually show up for the appointment. So according to there's a website that's called thepracticeinstitute.com, and there was a blog post recently by Dr. Stephen Wallfish that commented that 25% of your new patients should be coming as referrals from existing patients. And you want to think about your patients as being your best reps in the field. So how do you do that? The best way is to invest in marketing automation solutions that cultivate interest. If you've captured an email and you've gotten permission to email articles to the patient and you kind of understand their interests by treatments or by a variety of information that you might have, consider sending periodic information to them and build up kind of a rapport with them, trying to get deeper understanding. What the idea here is that you want your patients to think of you as being an expert on a variety of the treatments that you give, and getting those patients, especially happy patients, to refer you to friends, family, business associates. That's the idea here, is that you're educating your patients to serve as your sales reps. You also want to engage in social media with selected patients. The idea is to stimulate reviews. And also, we think it's important that if you have a stronger relationship, you're more likely to encourage, to reduce no-shows. people are less likely to stiff you if they like you and they're sort of have a tie to you. And all right, let me continue here. So recently we did another webinar covering the importance of Google My Business, and we can in the follow-up email to this, I'll send a link to that webinar as well. Crucially important if you're doing high-level AdWords spending to get your Google My Business page verified and maximized and optimized. There's some really important benefits for your program that are unlocked when you do that. You see location extensions are unlocked. If you have a multi-address practice, all those are unlocked with your Google My Business account. And that also helps in targeting the user, because if Google understands where the person is by a GPS chip in their cell phone or by the IP address of their desktop connection, and they understand that your practice is a verified location, that dramatically refines the accuracy of the web search experience. And so Google really rewards people that have gone to the trouble of verifying the business address, because it makes the search experience that much better for their customers. And adding or updating your addresses in Google My Business automatically updates those valid addresses that are used in AdWords. So it's just it's kind of a labor-saving step to be able to do that. So the fourth boost is to be able to take advantage of a service that Google offers that's called seller ratings. And these are primarily driven, you can see here the orange stars that appear in ads, and primarily they're used in e-commerce, specifically in kind of durable goods that are bought online, and also in hospitality, where you have resorts and things like that. And they're driven by reviews that are collected from trusted third-party publishers. It's not necessarily Google themselves, but there's a lot of other services such as Trustpilot or FIFO, or a few other, Ecomi is another one. And these are services that solicit customers through emails and request reviews and then publish those reviews. And so here's kind of an example of how that works, where the review itself appears and the orange stars appear up on the top. And if you click here on rating, the reviews are then, you can see all the different reviews that are published. And so it's a very powerful way to authenticate the value of your offer. In this case, this is Google Consumer Surveys, but it could easily have been Trustpilot or any other kind of service. Once this is integrated, though, this is the only way you can activate those stars inside your ad program. So here's another example. Here's an ad without seller ratings, and then here's an example of an ad with seller ratings. And you can see right away that it's just a lot more attractive. It immediately, your eye is kind of drawn to the ad, and it tends to lend a lot of credibility. Unfortunately, up until now, this type of feature has really never been available to healthcare advertisers. There's never been kind of a neat way to kind of do this. With the help of one of those trusted third-party providers, though, we've come out with a new product that we call Ad Enhance. And this is a combination of seller reviews, seller ratings that are integrated into the ad automatically, as well as activating some of the advanced features that Darren talked about, such as location extensions, and even providing a unique tracking number that gets added to your ad, and also for mobile click-to-call mobile ads. And so the tracking number and the call recordings are available in your Doctor.com admin. And the way this works is that these are linked to our Review Hub product. And this is our in-office review collection kiosk. Your staff collects verified patient reviews at the point of care, and those reviews are then published by one of those trusted third-party Google publishers. And if you meet the minimum criteria, which is 30 reviews of at least 3.5 stars or more, if your account meets that criteria, then your AdWords account is automatically qualified and eligible for seller ratings, and then you can take advantage of those features. So we've created a special page. You can check that out. It makes tremendous sense if you're spending at least $1,000 or more per month, because according to Google's own research, using seller ratings can improve your click-through rates by 18%. So doing nothing else, you're basically giving yourself almost an 18% boost in performance, not to mention the other advantages to your organic search results by having all those reviews that are collected as part of the Review Hub process. So let me just kind of summarize here. I know we've covered a lot. The first point I think that both Darren and I heartily agree is that AdWords can be extremely cost effective if and only if you can precisely measure and control conversions, and you can focus on patient lifetime value. If you don't understand or can't control all the elements of conversion, it really is something you shouldn't be spending the money on. I think there's a lot of areas where it's better to improve before you even try this, because it can get expensive very quickly. At the very least, you should have a very good understanding of your patient lifetime value. And we did a survey before this webinar, and only about half of our participants on this webinar really could document. We didn't ask them to document it, but just asked them the question, do you know? And about half admitted no, they don't know. Crucially important that you understand the lifetime value before you embark on this one, because that can determine whether AdWords is too expensive or not too effective. If a keyword costs $50, that sounds very expensive, but it could be very cheap if you know that your lifetime value per patient is $20,000. You should invest in a well-trained staff to convert price shoppers into patients. You should have a great in-office repertoire to convert treatment plans into procedures. Think holistically about the entire chain of actions here. It's not just AdWords, but it's what happens when the phone rings. Your staff should be well motivated with commissions for things that they can control, like no-shows and qualified patients. Some sort of incentive and quota to make sure that they are really trained for that one. It's our recommendation. Sometimes this can be impractical, but it does make sense to dedicate a person to be inbound sales savvy. Too often we see really great ad campaigns that are just thwarted by having either the phone not ringing or an off-hours answering service botching the call. Really, any call that comes in from a paid search should only be handled by someone who's highly qualified to talk to the patient and convert that shopper into a patient that keeps the appointment. And call recording and playback with constructive coaching is really also another step of continuous improvement and continuous learning. Trying to make this a scientific process. One of the great things about AdWords and any kind of digital marketing is you have really precise information about what's working and what's not. But as with any scientific method, it needs to be studied and carefully analyzed and refined. So AdWords, as Darren was saying, AdWords is an auction system, and occasionally you have uninformed or spendthrift competitors that are really driving up bids in the short term. Like the $50 keyword could be like Beverly Hills cosmetic dentist. That may or may not be expensive, but once you know your lifetime value and your conversion percentage, you know whether to take that bet or not. So in the short term, if pricing and the AdWord bidding becomes irrational, you can shut off and not take those bets. And you can let the irrational or the ignorant bidders kind of spend themselves blind and then run out of money. But the point is, you have a lot of power because you know your true costs and the value of your customer. And other lesser competitors down the street might not know that. And the other thing that's really important, and this is where just continuous kind of knowledge and insight, bidder ignorance may uncover some really good golden opportunities. So for every person that's bidding $50 on Beverly Hills cosmetic dentist, there could be a $5 keyword that's a niche keyword that's almost the same thing. One thing that when you look at the search query reports, it's very eye-opening to see the range of different words that people are using to find you as the practitioner. And it's not just the common marquee keywords. There's a lot of information that's there. And those words, as long as you're smart enough to leverage that information, those keywords can be extremely powerful because it can dramatically lower your cost per click. And every keyword that's $5 can be just as good as that keyword that's $50. And the final point, I guess it's kind of related to that, is focus your attention to looking at the language and the behavior of new patients. Not just the search query report, but be aware of what patients are saying online, in reviews, on social media, understanding what new search terms they might be looking for. And as Darren said before, a lot of times patients can be in sort of an information seeking mode. So if you have great content that describes procedures, that describes different types of treatment options, simply referencing that can be really great to engage a patient. And a lot of times that's where lead cultivation comes in, is those patients are shopping around and asking a lot of questions, and you want to capture that information, capture the email, and then nurture that lead, because especially if it's elective, say it's elective surgery or some sort of non-emergent condition, it's very important that you think about the click as being the start of a conversation and not just the be-all and end-all of that process. That's all I think we can say without kind of beating the horse to death. So now we'll give everyone else a chance to say something, and I'm going to turn this over for questions. There is a chat function inside the webinar, and so I'd like it if people could just take a moment, and if you have a question, please put it in the chat function. Okay, I see one question. Sam B. How many ads should I write? 10 or 10,000?
I guess I can take that on. It's probably between 10 and 10,000 would be my guess. The challenge with writing the ads is you're not going to be able to make decisions about which ads are more effective from a statistical standpoint without quite a lot of impressions. There are great sort of A/B testing tools out there on the web that'll do a quick A/B test for you. Usually you're going to want, if possible, to compare ads based on conversions, and you're going to need at least 10 conversions per ad before you would try to make a decision. And so, that could mean it's difficult to, depending on, again, the volume of searches, you may not get a good conversion comparison. Now, that shouldn't stop you necessarily from writing dramatically different ads. So sort of changing messaging and taking a completely different tack may be the way that you can sort of speed up the difference between the two ads. You might get some indications that a new creative approach is getting a higher click-through rate, which may suggest it's going to get more conversions. But the challenge is not to necessarily chase those clicks if they're not converting. So, I would start with a few good ads, probably even less than 10, probably 4, something like that, and start to whittle them away based on click-through rate to start, and then really make decisions about them based on their conversion rate.
One thing that we've done, Darren's approach is a little more handmade. Our approach is a lot more algorithmic and brute force, given the scale of the different clients that we have. But one of the things that we've looked at is coming up with rules about keywords and just how many times a keyword is shown relative to a number of impressions. Because you don't want to have something languish there for too long, and if you're not getting at least one, our rule of thumb was 1 click for every 200 impressions, and if it didn't do that, then we'd pause it and retire it and kind of analyze to see what's going on. But it's one of the things we've learned over the years is that it's very important to establish early credibility for your account and try to get your quality scores to go up as high as possible, as quickly as possible. And so the budget limit that you described before about spending as much as possible, as soon as possible, that helps build up the number of impressions. Also, making sure that you feed the fire as opposed to putting a big log on the fire. That was another way to do that, is that if you can build early credibility, then you want to just watch your quality scores to make sure that you are at the 7, 8, and 9 level. If you at the 1, 2, and 3 level, that's kind of another red warning flag, and you really have to shut that down as quickly as possible. Okay, here's a question from Bennett. If using exact match, do all the words in the keyword phrase have to be present for it to trigger the ad? Also, if it has all the words, but even more words in the query, will it trigger your ad?
So exact match means exactly what it says. It has to be those keywords only in that order. So if you're searching Aetna radiologist and you make it an exact match, the only thing that will trigger your ad is someone typing into Google Aetna radiologist. For phrase match is when anything can appear in front of that, anything can appear after that. So if your phrase was Aetna radiologist, people could search the best Aetna radiologist in New York City, and your ad would be triggered. So those are the big differences. And then modified broad and broad, word order doesn't matter at all. And modified broad requires that the terms appear, whereas broad means Google can make any sort of random, it won't be random, but it'll be a related suggestion. It may put in synonyms, it may put in topics that are similar. And I've seen that their matching has gotten a bit better over the years. In the past, I completely avoided broad match because it was so off topic in some cases, but I don't see that as bad as I used to in the past.
Okay. Let's see. Judy is asking, is there any difference in geo-targeting between desktop versus mobile? So
yeah,
I have one anecdote about this one.
Okay.
But
yeah.
So from what I understand, in suburban areas, Google is pretty good at geo-targeting. They know where you live, and they know where your mobile phone is located. The GPS chip, in combination with things. If you have a Google profile and you've put in a lot of information about where you work and live in your profile, the chances are that Google is really sure that you're going to be in a certain area. In urban areas, it gets really messy. GPS signals are not necessarily the most accurate. We're in Manhattan right now, and it gives kind of a mixed bag. And there's also, I've heard some people comment that the IP address of my wireless phone connection is actually about 8 miles away from here at a data center out in the Meadowlands of New Jersey. So it's the phone is located in Manhattan, but Google has a really hard time of accurately pinpointing that if it can't find a GPS signal. And the IP address of my mobile data carrier is actually plugged into the internet in Secaucus. So it's a combination of a couple of things that when you're geo-targeting campaigns, you really have to be very careful and kind of look. There are other reports inside your campaign where you can search for the exactly where the searcher was located when they made that search, and then you can identify other exclusions that you need to put on there. We've seen interesting things, like if you put in Manhattan dentist as a keyword, you wouldn't think to exclude anything else, but yet in fact people from Manhattan, Illinois are being targeted and serve those ads. So you actually have to exclude every other state except New York when you're targeting just people in New York, and those are wasted clicks. That's going to drive up your costs. So it pays to just prune away all that waste. Well, I guess that's it. I think we've answered everyone's questions, and it's better to be early than late. So we'll summarize. What I'd like to do is everyone's registered for this, so we'll send out a copy of our slides and our contact information. Feel free to contact either one of us if you have any kind of questions. The Ad Enhance page will kind of answer some basics there, and I think there's a phone number there, as you can contact one of our client specialists who can talk to you a little bit more about that program. Thank you very much for watching and listening, and we will catch you the next time.